Hi everybody, I'm Helen.
And I'm Luke.
And we're both from Hilton House Medical. And we thought we'd hop on today and have a brief chat about all things moles, skin tags and warts, and help you understand a bit more about what's normal and what's not normal, what you need to look out for. And also just to mention that if you have any questions at the end, you can always contact us here at Hilton House and we'll be happy to help you out with any of your queries. Without further ado though, Luke, thought we'd get straight into it and start with moles.
Yeah, let's go for it. So I should say the reason we're talking about these is because it is something that we are offering in the clinic, so mole removal, skin tag removal, things of that nature. So if it's something that you're looking at having done, get in touch. So first things first, to start with moles, and all three of them, is to say that they are not the same thing. So moles, skin tags, warts, all three very, very separate. So moles. Moles are a cluster, or moles are clusters, I should say, of pigment-producing cells, pigment being what gives your skin its colour. Most are completely harmless, and you can have anywhere from 10 to 40 by adulthood.
Wow, 40?
Yeah, well, I was thinking, because I can think of, I've got one on my hand, I've got one on my face that's hidden pretty well. Maybe that's one. But like
I've got one there that I've had all my life.
Yeah.
And it's never changed, moved or anything.
Yeah, I think sometimes they can be really noticeable. Sometimes, like mine aren't. If you look at them, you wouldn't see them straight away or from a distance. So, yeah, apparently you can have between 10 and 40. I suppose there's lots of places I wouldn't know. Like, I don't often look at the back of my knees. So maybe there are some hiding. I don't know.
Back of your ears.
Yeah.
No.
So some interesting facts about moles. The average adult has more moles on the left side of their body. This doesn't necessarily track when it comes to the UK, and I'll tell you why.
Okay.
So it's because of sun exposure while driving. So most countries, because of the side of the road they drive on, it affects the left side, whereas because we drive on the other side, it affects our right side more. I remember years ago, I went to an art exhibition by a photographer, and I distinctly remember there were two photos, one of an office worker whose desk was next to a window, and another who was a truck driver. And the truck driver, you could quite see almost like a line down the middle of the face. That this side of the face was completely normal, and this side of the face was really quite sun damaged, with a lot of growths on that side of the face. And the office worker, you had to look carefully, but you could see that she was visibly more aged on the side that the window was than she was on the other side.
So the rule of thumb here is make sure you wear your SPF.
Yeah, 100%. 100%.
At
always,
least factor 50.
Yeah, always have some sun cream on, unless you're indoors all the time.
Because I think that's what people think, that because it's not that sunny here, you don't need to wear a high SPF, but you do.
You do, especially if you're quite fair skinned like myself.
And me.
I'm always in sun cream. Another interesting fact, some moles actually fade with age. And if you've got a hair growing out of your mole, that's completely normal. The one on my face is quite hairy.
Lucky you.
Yes, such luck.
Okay, that's interesting.
Yeah.
That they lose their colour as we age, something else that just...
Yeah, I didn't know that.
No.
And I've not noticed that with anything, but I'm quite young, so this time.
You're just a whippersnapper.
So what do we, in the clinic, what the doctors are looking for clinically is known as the ABCDE rule, which stands for asymmetry, border, colour changes, diameter, and evolving. So basically they're looking for certain markers of how that mole might be changing over time, or how it is initially presenting, because things like melanoma can either develop from an existing mole or they can completely appear as a brand new one. So I know that's what everyone tends to be worried about with moles. But again, the vast majority of them are harmless. But if you do see a new one, or you notice one that all of a sudden is changing shape or colour, it's worth getting it checked out.
And it can be obviously different to a brown spot, let's say. So if you've come back from holiday and you've noticed you've maybe overdone it in the sun a little bit and a brown mark starts appearing on your skin, that's completely different because the moles can be quite raised, can't they?
So then moving on to skin tags. Again, something I have quite a lot of experience with.
Oh, really?
Yep.
Share away.
So when I was younger and I was in the Scouts, we went on a trip to Switzerland.
Lovely part of the world.
Oh yeah, very nice. So being in the Scouts, you have to wear a neckerchief, right? And I had a skin tag from when I was very young on the very back of my neck, and there's still a slight sort of remnant of it. And it would always rub on things like my neckerchief or a shirt collar or whatever. So I wouldn't recommend this without speaking to a doctor first. But what we did is we got some string,
twisted it,
tied it around, and made it very tight because we were told that's what you had to do with them to get rid of them.
Luke,
so
we're not supposed to do that. Just like dentists don't recommend.
I don't recommend
a bit
doing
of string,
this.
attaching it to the door handle.
To a GP before doing anything. Don't do what I did. Don't follow my example. Anyway, we got on the flight.
Did it bleed?
No, nothing. I didn't even. Well, we got on the flight to Switzerland, and I had a skin tag. I got off the plane, and I didn't. So somewhere in the sky is a little piece of me on a Ryanair flight, probably.
Or it's landed in someone's
or it's
porridge or something.
But skin tags are soft, flesh-coloured growths that usually appear in areas of friction, such as the neck, armpits, under breast, and the groin area.
That's interesting. It runs in families.
It can run in the family. I don't know whether either of my parents were particularly susceptible, because I've noticed quite a few skin tags that I've got over the years. They are genetic. They can run in the family. And they're completely benign. But people remove them, like myself, because they catch on clothing or for cosmetic reasons.
Okay.
So they're not generally, skin tags aren't really something to be worried about, but they can cause discomfort. The one on my neck, it used to drive me insane because it'd get red, it'd get sore.
Bit itchy?
Yeah, sort of. It's just, they can be a little bit annoying, a little bit painful sometimes. But they're never usually anything, serious or dangerous.
Are they easy to remove, apart from what you did?
Well, I don't know how, and it's a very quick op to have it done in clinic. The way I did it was also painless. Not recommending it, but it's a fairly simple procedure.
Yeah.
I think you have to be careful about cutting them because they can bleed a lot. But there are lots of different ways of getting rid of them.
Okay.
And then finally, we have warts. The warts are caused by HPV, the human I can never say that word. Papillomavirus. I've never been able to say that word.
HPV for sure.
HPV. That's probably why people say HPV. It's just a lot easier. Again, I had a wart when I was younger. I used to have the scar on my thumb, but I don't have it anymore. And as we'll find out.
Because that's the same thing that causes cold sores, isn't it?
Yes, yeah. So fun fact, they can disappear spontaneously. That's what mine did. I just woke up one day and it was like half the size, and then the next day it was gone. Okay. No removal or anything needed.
You must have a strong immune system then.
Well, there we go. Your immune system can literally wake up one day and decide to get rid of it. But there are lots of topical gels you can get for them, lots of stuff at the pharmacist that you can go and ask about. And again, you can speak to your doctor about any warts you might have concerns on.
And they're contagious.
Yes, they are. They are contagious. And very much like cold sores as well.
And verrucas, perhaps.
Yeah, I think it's all part of the same virus.
Mm-hmm.
But they're only contagious through tiny breaks in the skin. So just touching, it's not a problem. If you've got any breaks or anything like that, then they can be transferred. Okay. And you don't get them from touching frogs. It's a myth.
That was my next question.
If anyone believed that myth, you're just like me, because I did until I was about 20. Not that I'm going around touching loads of frogs. Oh, I really like frogs, to be fair.
I like frogs. Just not
Yeah.
spiders.
So, just if you do notice any of these, if you go onto Google, you've probably Googled something like this at 12:30 at night, and reckon that this is the end now. It isn't. Most times they're nothing serious. The only one really to look out for are moles, because they can become a lot more serious, and some warts as well might be worth getting checked out. Skin tags, they're not really a big deal. They can just be a little bit uncomfortable.
Yes.
Okay.
An annoyance more than anything.
Yeah, exactly. So don't just assume because a mole's changed a little bit of size that it's red alert emergency. But go and speak to a GP. Come and see us.
Particularly if it starts to change colour.
Yes. Yeah. Any sort of changes in your moles, just get it checked out just to be safe. But a lot of the times it isn't anything serious.
Yeah.
Right, moving on. Now I'm going to take this from you because there are answers on this sheet to the next section, which is a quiz. And we're going to do this more regularly because...
And you give me no warning about it whatsoever.
It's really fun to put Helen on the spot. So that's why we're going to do it.
Okay.
So today is an eyeball quiz.
Oh!
And you can play along at home. So, question 1. True or false? You see everything upside down. So it's not that the world is upside down, but all the information you're gathering from your eyes initially is inverted.
That's got to be true.
It's true. And your brain takes that data and flips it. Now, I could be wrong, but when I was in high school and we had a science class, we did a little experiment where I'm sure we somehow got some light to go through a small aperture in some cardboard, and the image it produced was upside down. As far as I understand it, it's the same mechanism going on with your eyes.
I wonder if that's also like looking through a kaleidoscope, where the image is.
Yeah, how the light's being sort of diverted, and it creates
just the back of your eye and
similar sort of thing.
Okay, interesting.
So it is true.
Okay.
Question 2. How much of your vision is actually high definition? Is it 50%, 25%, or less than 5%?
I'm going to go safe and say 50%.
Incorrect. The answer is less than 5%.
Oh, really?
So only your fovea sees in high resolution, basically meaning the very centre of your vision, wherever you're focusing, is high def.
Okay.
But everything in the peripheral is much lower resolution. Your brain is filling in the gaps.
Oh, how clever is that?
There is a lot of work that your brain does to interpret the information your eyes are getting.
The internal computer.
Yeah, 100%. Without the brain, these eyes would be nowhere near as good. Okay.
And that we should say as well that it's always important to get your eye tests as well.
Yeah.
Because so much can be picked up from just that routine eye test.
Yeah. Any eye concerns, we can see you. By all means, go into the clinic. We're not specialists when it comes to the eyes. That's left to the opticians. Yeah. But if you've got any concerns, we're more than happy to be a first port of call. Yeah. All right. Question.
Your eyes can also tell you a lot from our point of view what's going on internally.
Yes, 100%.
As well.
100%. Question 3. Can your pupils dilate, so get bigger, because of attraction? If you see someone that you really fancy, do your eyes get bigger?
Yes.
It's true. They do.
Same way it does when I see a big fat cream cake.
Yeah. Yeah. Your eyes can dilate because of chemical reactions basically going on in your body due to the emotions that you're feeling. Have a look into it. It's really, really interesting.
And that's why on some of these cartoons where you see somebody, I'm trying to think of a character now, I can't think of one, maybe Popeye, someone like that, and he used to get heart-shaped when he saw somebody. Pepe Le Pew as well.
Yeah, it's all based in reality. All based in reality. Talking ducks, and it's all based on reality. So, question 4.
Oh, there's another one.
This is the final one.
How many
Final
questions have you got?
This is the last one.
Okay.
They're going to get longer each week. Do your eyes have a blind spot? Is there somewhere in your vision you're not picking up anything?
No.
Yes, you do. Your brain just edits around it so you never notice it.
Again, how clever.
If I remember correctly, I've not got it written down here, but I looked into it. There is a section at the back of your eye where there aren't any nerves that sense light. It's basically just a hole in the back of the eye, and that's where the blind spot is. But your brain can just sort of filter. Okay, there are some like experiments you can do online where you sort of hold in your finger and you bring it to a certain
I've seen
point
those. Yeah,
and it disappears.
Mm-hmm.
But yeah, it's a thing, and your brain is basically running a live Photoshop filter on reality.
That's amazing.
Yeah.
Thanks for sharing that.
No problem at all.
That is really amazing.
You did. What did we get? You got 50%.
Oh, there you go.
You got half marks.
I can always improve
without any revision. So well done. So I give you your sheet back now.
Okay.
Because now we're going into segment 3.
Okay.
Which is the top stories that have recently been in the news to do with health. So the first one I've written down here is about colorectal cancer rising in under 50s. It's quite serious. Quite a big thing at the minute, because colorectal cancer has now been announced as the leading cause of cancer-related deaths in adults under 50. So whilst overall cancer deaths are declining, colorectal cancer is rising, especially in young people, which is a little bit unusual.
It is, isn't it? They've not really explained why. No.
So there are quite a few theories as to why. I think we might come into those a little bit later.
Okay.
But this has all been brought about because of some recent high-profile deaths, unfortunately.
Yes.
People like Catherine O'Hara and James Van Der Beek. Both have been linked to colorectal cancer. It often starts as small polyps in the colon that slowly become cancerous. And the things you really need to watch out for are rectal bleeding, blood in the stool, persistent bowel changes, narrow stools, and the constant urge to go to the toilet, but nothing passes. The earlier these things are detected, this goes for all cancer-related illnesses, the earlier we detect it, the better rate of survival that we get. It's quite dramatic. So coming on to why they think this is happening, there's been a lot of research from the University of Southern Denmark recently about a newly identified gut virus linked to colorectal cancer, which could potentially improve early detection in the future. So things are happening, people are looking into these things, but yeah, the main takeaway being if something feels off, get it checked.
Yeah, and if any of these things continue, it might be that you might experience something for a day and then it goes away. That's fine, nothing to worry about. But if it persists and it happens quite frequently, then that is the time when you should just really get it checked out. Yeah. Just for your own peace of mind.
Yeah.
More than anything.
Next is a little bit of a lighter subject. And this is that some scientists have found
I love this.
a link between bird watching and brain health.
Amazing.
So this was a Canadian study published in J Neurosci magazine. They found that expert bird watchers had denser brain tissue in areas linked to attention and perception.
Which goes back to get outside in the fresh air.
Yeah, it'll do you loads of good. The study came from researchers at the Rotman Research Institute, and what it's basically getting at is to say that learning complex hobbies, whether that's bird watching, painting, some forms of gaming, some board games, particularly jigsaws, any sort of complex hobby, may physically reshape your brain through neuroplasticity. Okay. Basically, training your brain. There's been loads of studies on these things.
Yes, there has.
There was a big study done a few years ago on young men who gamed, and they found certain areas of their brain were really well trained in certain areas, problem solving, sort of like strategic things of where to place things and whatnot. So they do have an effect on your brain.
And it keeps your brain active,
Mhm.
which another big topic in this country that has been arising over the years is Alzheimer's.
Yep.
And so doing these sorts of things, keeping your brain activated, doing little things. I like to do Sudoku. I do like to read, those sorts of things, and jigsaws. And it just keeps your brain sort of giving it a little workout, aren't you?
Well, that's it. You've got to treat your brain like
Yeah.
a muscle, and it needs, it needs to be worked out. You need to push it. You need to use it in order to keep it.
Exactly. So all of us who are guilty of just staring at our phones.
Yeah. Yeah, it's probably not the best use of your time if you're wanting to brain train.
Just think to yourself, in this, 45 minutes I've sat here watching something, I could have been doing something else.
Not that we don't want you to watch us.
No, of course not.
Stay for us. We're the only people you should watch, really.
We're informative.
Totally. Yeah, we're helping. Finally, I just thought this was a bit of an interesting story. Is a lady in Birmingham.
I've heard about this.
A lady in Birmingham caught sepsis after a dog lick. Woman in UK developed sepsis after a dog licked a small cut. She deteriorated rapidly and ultimately required quadruple amputation. I believe, all this took less than a week from the lick to the end result. So very quickly things went downhill. Now, this is extremely rare. So don't be, going home and thinking, got to get rid of the dog. It's most likely not going to happen to you. Okay. But it does highlight, the main thing to take away is how serious sepsis is.
Yes.
So we'll go through the symptoms quickly. Sepsis can cause confusion, cold or mottled skin, blue lips, fast breathing, and rapid deterioration. If someone suddenly becomes very unwell, especially after infection, act quickly.
Yes, that's most important.
Yeah, sepsis can escalate in hours. I know that we do a lot of training through our training system on sepsis, what signs to look out for when we're in the clinic. So it's very, very serious. Anyone I know who's had sepsis, it's like a horror story when they talk about it. So if you can identify it early and get the person help or get yourself help, do.
Yes,
because
absolutely.
it very quickly can progress.
So I think basically the main message from today's discussion that we've had is that if you've got any of the things that we've discussed today, anything that's causing you a bit of concern, is to get help. And you're not going to get any better help than from an actual medical person, rather than looking at Dr. Google or other things online. It's always best to get in touch with someone like ourselves and just have a conversation if there's anything that you're concerned or worried about.
Yeah, I agree.
So, thanks for all the fascinating tips about eyeballs.
No problem at all.
And I guess one of us should take up bird watching sometime.
Yeah, not my thing, I don't think. I did once in Scotland. Someone showed me some birds, but I think I lost interest in about 10 minutes.
Oh, I love birdsong. Birdsong's beautiful.
Yeah.
Maybe I'll take it up now.
I was when I hear it at 5:30 in the morning. No.
It's not quite the same when it's dark, though,
it's not.
it?
No, it's not. Go back to bed. That's what I say to the birds.
Okay, so thanks for watching. And if you've got any questions, please pop them down below. Or if there's anything you would like us to discuss, there's something that you're wanting to ask, but you're not too sure how to go about it, we're happy to discuss anything that you may be concerned about. So please do get in touch with us. And in the meantime, stay tuned for the next edition.
Yep, like, comment, and subscribe. Really helps the channel. Thank you all.
Thank you so much.
Take
See
care.
you soon.
Bye. Bye.